You're watching Global BC. This is Global News Hour at 6.
Good afternoon, I'm Chris Gillis, and today we have invited two guests onto our show to discuss the growing movement in Canada for further decriminalization of illicit substances. Before we begin, however, I want to give some background information on the law regarding this issue. The Controlled Drugs and Substances Act, or CDSA, is the federal act that determines which drugs are illegal and other relevant criminal procedures. Earlier this year, Bill C-22 was enacted, which removed mandatory minimum penalties and instructed judges to look at alternative measures of justice for recreational possession cases. And with that, we welcome Mr. Connor McDougall and Mr. Dylan Factor to the show. Thank you, Mr. Gillis. It's a pleasure to be here to discuss such an important topic. We are currently in the midst of a drug crisis, and it is clear to see that our current methods are not having the impact we need to solve it. According to federal data, since the beginning of the COVID-19 pandemic, drug abuse-related deaths have increased by over 88% as compared to a similar period from before the pandemic. Additionally, this drug crisis creates a substantial economic burden on the country. This burden is primarily composed of additional costs incurred on the healthcare system, costs of lost productivity, and the costs of judicial involvement. Attempting to provide adequate care to those in need due to drug use-related issues costs money that taxpayers are on the hook for, as well as it diverts limited resources, such as hospital space, away from those who may be in need. While much has been done to streamline the judicial process as regards drug use, we still spend more on criminal cases involving possession than we really need to. Lastly, while it's difficult to quantify the cost of lost productivity and the impact that individuals overdosing has on their families and acquaintances, these are still meaningful issues that need to be addressed. With these facts in mind, we need to find a new strategy as a country, and I firmly believe that we should look to emulate what Portugal has done over the past 2 decades and shift focus to a strategy involving mass decriminalization alongside support programs for those in need.
Although there are a lot more drug-related cases, Vancouver cannot do much more to solve the issue. With the amount of obvious drug use almost everywhere in Vancouver, it seems as though decriminalization of drugs is already in effect. Not to mention that Vancouver already has a drug addiction strategy revolving around 4 pillars: prevention, treatment, harm reduction, and enforcement. And as shown through cities in Europe such as Geneva, Zurich, Frankfurt, and Sydney, this approach should already result in a dramatic reduction in the number of drug users on the street, a significant drop in overdose deaths, and a reduction in the infection rates of HIV and hepatitis. On top of this 4-pillar strategy, Vancouver is already a pioneer in the way that they handle drug addiction, as they are the first city within North America to have legal, supervised, safe injection sites. These facilities already operate under Health Canada exemption from persecution under federal drug laws and have been shown to reduce the number of users on the street, help users get the medical care that they need, as well as bring stability to the community. Additionally, you mentioned that the federal government is already taking steps to reform the justice system's involvement with drug-related crimes. But how much lower can they go? I don't know about you, but it feels morally wrong to not try to pursue all the drug dealers supplying the drugs that are killing people on the streets.
While I agree that the City of Vancouver has taken great steps towards implementing decriminalization, the current model they have does not go far enough. Limits on possession amounts are still too restrictive for an average addict, which means that police and overall criminal system involvement is still higher than it needs to be. Not to mention the fact that when the model was designed, the council neglected to consult with groups representing addicts, which is concerning and overly paternalistic. Without consulting with all affected groups and designing a proper model with realistic restrictions, we are highly unlikely to see the desired effects, such as decreased healthcare spending related to the crisis and falling overdose rates. This issue has proven to be one that regulation, taxation, and other conventional methods for closing externalities are ineffective for. Vancouver is in the unique position of being the leader in implementing this new approach to help this health crisis we find ourselves in, so it is even more important that it gets the policy set up correctly.
I agree that more work needs to be done, but I don't think decriminalization is the answer. You've talked about the externalities that our current system creates, and that is certainly a valid point, but have you considered the consequences of increasing possession limits like you have suggested? Some commentators have stated that if we increase the possession limits for drugs to meet the needs of some users, we would also create an unintended consequence of making drug trafficking easier for dealers. This would be seriously detrimental to the program's success, as well as to the health and safety of the very people that we are actually trying to help. I really do believe that there's a solution out there for this crisis, but that solution is not decriminalization.
Thank you for your time, gentlemen. It is clear that Canada has arrived at a crossroads regarding how it handles this crisis. It's hard to say what the impacts that some of these changes will have on Canada and our future. With that, we conclude this segment. Thank you for tuning in. Now on to the weather.